I'm Dwayne Brown. Tonight on KPBS Evening Edition, the petition drive is underway to try to stop San Diego's minimum wage increase. Who's behind it, and what happened when signature gatherers approached one of the biggest backers of the pay raise. Also tonight, 2 American medical workers are out of the hospital after being treated for Ebola with a drug from a San Diego company. But does it mean the drug works? We'll take an in-depth look.
And how are San Diego's community clinics faring a year into the Affordable Care Act? I'm Peggy Pico with that update. Plus, college freshmen are moving on to campuses, what students and parents need to know about first-year jitters, and how to survive the transition. And here's something for a hot August night from San Diego Dance Theater. It's time to sweat. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. The campaign to reverse City Council's decision to increase San Diego's minimum wage is officially underway tonight. Signature gatherers hit the streets earlier today asking voters to force a decision on the increase at the ballot box. KPBS reporter Claire Trageser was at the launch earlier this morning, and she joins us now. So, Claire, tell us who showed up for this signature gathering effort.
It was 6 San Diego business owners, 5 of whom own home health care companies. They're part of a group called the San Diego Small Business Coalition that's opposing the minimum wage increase.
And who's actually behind this coalition?
A spokesman for the group says it's a group of businesses that are funding the $500,000 they say it'll take to get the issue on the ballot. The group is also being backed by the San Diego Regional Chamber of Commerce and the California Restaurant Association. But at the announcement today, those interests weren't visible. Instead, it was the group of business owners, including bookstore owner Ann Kinner. She says she'll have the petition at her store and will ask everyone who comes in to sign.
My first question is going to be, are you a resident of the city of San Diego? If they say yes, then I will say, well, we are hoping that you will help us to fight this city-imposed increase in minimum wage. We don't believe that it's appropriate. We don't believe either that the city council should be mandating something when 60% of the population said they wanted to see it on a vote. We want it on the ballot.
They want it on the ballot. So, Claire, what does this coalition need to do to get the issue on the ballot?
They need to collect almost 34,000 signatures by September 17th. And another group called Raise Up San Diego is working to hinder their efforts. They will send out supporters to stand next to signature gatherers and ask them not to sign the petitions. In fact, some of them are already out handing out these small cards asking people to call a hotline if they see signature gatherers.
KPBS reporter Claire Trageser. Council President Todd Gloria says the signature gatherers are already giving out misinformation. He was approached today by one of them and recorded it on his cell phone.
To keep the minimum wage down?
What's that?
Have you signed the petition so that the state can't force the city of San Diego to increase the minimum wage yet?
I support raising the minimum wage.
Okay, cool. Hey, bud. Can I get you a sign of this?
Of course, the state has nothing to do with San Diego's minimum wage plan. We talked to a spokesman of the petition drive about this video. He says it sounds like the signature gatherer just got the script backwards. He says they won't tolerate anyone misrepresenting their cause. California's Attorney General says she will appeal a federal ruling on the state's death penalty. Last month, a judge ruled it was unconstitutional because it takes too long to carry out. Kamala Harris says it was a flawed ruling, and while she opposes the death penalty, she says the ruling needs to be reviewed. 2 American medical workers are home tonight after being treated for Ebola. Doctors at Emory University in Atlanta made the announcement today, and one of the patients, Dr. Kent Brantly, hugged his caregivers and declared this is a miraculous day.
I'm thrilled to be alive, to be well, and to be reunited with my family. As a medical missionary, I never imagined myself in this position. When my family and I moved to Liberia last October to begin a 2-year term working with Samaritan's Purse, Ebola was not on the radar.
The other patient, Nancy Writebol, was released on Tuesday from the hospital. She was also a medical missionary in Liberia. Brantly and Writebol were the first to receive an experimental drug called ZMapp made by a small San Diego company. Not everyone treated with ZMapp has lived, but most have. However, researchers still can't be sure the drug works. KPBS science reporter David Wagner takes a look at what we do know about the drug.
In most cases, Ebola is a death sentence. But for the 6 people treated with ZMapp before supplies ran out, odds of survival have been high. Though one of them, a Spanish priest, has died, 3 West African doctors are reportedly improving, and 2 American health workers have already been discharged from the hospital. So, does that mean ZMapp works?
6 patients just doesn't give you enough statistical power to make a determination as to whether the drug is working.
That's Donald Forthall, Chief of Infectious Diseases at the UC Irvine School of Medicine. To truly know if ZMapp works, researchers would need to carefully compare large numbers of people who take the drug with large numbers of people who don't take it. Setting up rigorous trials in the midst of an outbreak wouldn't be easy, but Forthall says,
clinical trials can be done there, and they really have to be done there because there won't be opportunities to do them anywhere else.
Other Ebola experts see this unexpected rollout of ZMapp in a more promising light. Erica Ullman-Sapphire is a professor at the Scripps Research Institute in La Jolla. She was out of town, but we reached her by phone.
So it certainly didn't hurt them. In fact, they started recovering. So it either did nothing or was helpful. My hunch is that it was helpful.
For the past 10 years, Sapphire has been looking at Ebola under the microscope, working to pin down antibodies best suited for combating the virus, antibodies that end up in drugs like ZMapp. Human trials have not gone forward yet, but Sapphire is confident in ZMapp's safety. So confident, she says she'd take it herself, just like those 2 American health workers, Dr. Kent Brantly and Nancy Writebol. But is she equally confident the drug works?
I mean, we didn't take Dr. Brantly and Mrs. Writebol and they're identical twins and treat one and not the twin. That would be the data I would need to say it confidently works in humans.
Studies in primates have shown that ZMapp can greatly improve chances of survival, as long as the drug is administered within 2 days of infection. By the time humans start displaying Ebola's worst symptoms, it might be too late for ZMapp to do any good. And there's another thing to keep in mind, ethics. I came to UC San Diego to talk to Michael Kalichman. He heads up the research ethics program.
A number of people said, look, we have a treatment that might work. We don't have anything else that does work. Why not try?
He says in a situation like this, research takes a backseat to compassion.
It wasn't designed first as a research study. We get what we can from it, and that's the best, most ethical thing to do.
MAP Biopharmaceutical declined to comment for this story, but in a statement on their website, they say they're working to produce more of the drug. The drug is grown in tobacco leaves, a process that will take months. But experts say the current outbreak is poised to drag on for months. If it's still ongoing by the time more ZMapp becomes available, more of the drug could be sent to the front lines. Even though Kalichman says researchers still aren't sure it works or is even safe in the long term. As for the 6 test runs of ZMapp conducted so far, what have we learned?
Get back to me in 6 months and we'll be able to answer that question.
David Wagner, KPBS News.
And video journalist Katie Shulove helped produce that story. PBS NewsHour will have more about the release of the 2 American patients tonight at 7. A new report says California is falling behind in policies to prevent and fight cancer, especially in tobacco control. The American Cancer Society says California is falling short with passing new laws about smoking.
You know, we used to be a leader in tobacco control, but because it's so difficult these days to pass meaningful tobacco control legislation, we're falling more and more behind other states. We're 33rd in the nation in terms of our tobacco tax. We're only one of 3 states that have not raised the tobacco tax in the 21st century.
California did receive a higher rating for policies funding breast and cervical cancer screening and for restrictions on minors using indoor tanning booths. San Diego will host a community health conference this weekend with leaders from healthcare clinics across the country. Peggy Pico finds out how they're faring 1 year after the Affordable Care Act.
San Diego's community clinics offer accessible health care for underserved patients. Now 6 months after the Medi-Cal expansion and 1 year after more than 120,000 people signed up for health insurance through Covered California, they're seeing a lot more patients. Here with an update is my guest, Gary Roto, Public Policy Director for the Council of Community Clinics in San Diego, Imperial, and Riverside counties. Gary, welcome back.
Thank you, Peggy.
Now, what's the range of services, if you'll remind us, provided at the San Diego Community Clinics?
So the community clinics focus on primary care services, and they'll include medical, behavioral, and mental health, as well as dental services.
And who tends to use these clinics? If you could tell us a little bit about the demographics.
Well, traditionally, they had been in medically underserved areas. A lot of people think of it as low-income areas. But certainly, over time, we've realized that we've needed community clinic-type services all across the county, all across the region. So you have a wide variety of folks, not only folks that are uninsured, though that's been traditional, and Medi-Cal, but also people that now have covered California and some other health care as well.
I was going to ask you about that. So has the change as far as the Affordable Care Act and Medi-Cal expansion changed the demographics?
It started to. We don't have the precise statistics yet, but certainly we know that the number of uninsured, the percentage, I should say, of uninsured that the clinics are seeing has gone down. There's still a significant percentage, but it has gone down, and that's because of these programs that people are now able to receive some type of coverage.
How about at the actual clinics? What kind of changes are you seeing after all these people have signed up for insurance now?
Well, one of the things that the executive directors of the clinics did was anticipate this, and there was federal funding that was put aside for additional sites and for actually adding and expanding services. So you've had additional sites that have been developed in many different parts of the region.
Okay. As far as the Medi-Cal expansion, is that also the same as far as the changes you're seeing there? They're pretty in line with the Affordable Care Act.
Even more so.
I see.
Because there's about 243,000 individuals that have put in a new application within that 6-month period, kind of parallel to the Covered California open enrollment. Those are new applications. County is still working their way through. San Diego County is working its way through in determining eligibility. And so people are already coming into clinic or other types of providers. And not all, but many will now have some type of coverage and benefit from our services.
How much funding did you receive from the Affordable Care Act, and how is that money being spent?
Well, there are a couple of different pots of funding. One of the most prominent was called the Health Center Trust Fund. There was $11 billion that was put aside at the beginning of the Affordable Care Act, and that was then put into different grants that have been rolled out over the past 5 years, one of which was new access points, adding new sites or a center beginning or transitioning to become a federally qualified health center. Others were for additional hours and staffing for expansion of services. And then some funds were also put aside to dramatically increase the opportunity for new physicians that would probably make less than they could in other areas to come back to these medically underserved areas and receive part of their repayment, part of their loan repayment taken care of.
From their student loans for becoming an MD here.
Exactly.
But you also received you also received a big grant, I should say, that ultimately worked out to about $250,000 per clinic. What's that for?
Well, 5 of our members just last week received word that they're getting $250,000 to be able to expand their behavioral and mental health services. They'll be able to do things like hire a psychiatrist or psychologist, hire additional assistants, but be able to expand the practice, because one of the things that we know is it's important to integrate medical health and behavioral health and do it in the same place and possibly at the same time.
Well, I know you touched on this. There was a lot of fear that the Affordable Care Act and all these patients signing up for insurance would overwhelm the system. There wouldn't be enough doctors to see the patients. Is that something you're seeing at the clinics?
There still is a provider shortage, but the clinics have also done some things to transform their practice management, implementing patient-centered medical home that really maximizes a team working with the physician as the hub, so that you have not just the physician you're working with and not just when you're ill, but keeping you well and being able to communicate with the physician between appointments, being able to partner and provide some innovative care as well.
What do you see as the biggest challenge because of this influx of patients?
You know, the biggest challenge is how do you engage people not just in having coverage, but having coverage and coming to see their doctor at the right time, well ahead of when something is urgent or an emergency room visit is necessary.
All right.
Keeping them well.
Okay, Gary, thank you so much.
A pleasure.
Bank of America will pay nearly $17 billion for its role in selling mortgage securities before the financial crisis. It's the largest settlement yet over the mortgage meltdown. California will get $500 million in consumer relief credits and another $300 million to reimburse its public pension funds for their losses. The settlement does not clear B of A from the risk of criminal prosecution. Encinitas is banning plastic shopping bags. That means shoppers will have to bring reusable bags or pay 10 cents apiece for paper. Retailers have 6 months to make the change. Farmers markets have a year. Encinitas is the second city in the county to pass a plastic ban. The State Water Resources Board is looking at the pros and cons of desalination on our coast. It's the process of removing dissolved minerals from salt water to produce fresh water for drinking or industrial purposes. Now, some researchers say California doesn't need to consider desalination just yet.
I don't think as a state California is anywhere near the place that Australia, Spain, Israel got to in terms of reducing their demand. We're just beginning to look at that in the middle of a drought, but we're nowhere near that. We haven't used our wastewater that we treat and dump into the ocean. So it's not that I'm against desal, I just don't think we're there yet. We have to do a lot of other things first.
A $1 billion desal plant is currently under construction in Carlsbad. A comedy star could face charges for putting an anti-SeaWorld message on a freeway sign near Mission Bay. Stephen Glover, better known as Steve-O in the Jackass series of hidden camera movies, he videotaped himself climbing up on a sign on Interstate 5, taping up his message. He said he was taking a stand for Shamu. Caltrans says defacing freeway signs is against the law, and they're referring this to the Highway Patrol. California lawmakers passed a bill allowing 15 community colleges to grant 4-year degrees. They'd be in select work-oriented majors like dental hygiene, automotive technology. San Diego Assemblyman Marty Block wrote the bill. If Governor Brown signs it, community colleges could begin offering bachelor's degrees as early as January. Now, tomorrow is move-in day for students at San Diego State as freshmen around the county prepare to begin their college life. Peggy Pico tells us how students can recognize if the school they picked is the right one.
Starting college can be exciting and stressful for both parents and students. Moving away from home, tuition costs, and the demands of college courses can be overwhelming. So when are second thoughts a sign a school may not be the right choice? And what can you do about it? Here with some ideas on sorting through the first semester jitters is my guest, higher education expert Lynn O'Shaughnessy, author of The College Solution, a guide for everyone looking for the right school at the right price. Lynn, welcome back.
Oh, thank you.
Now, many college freshmen are moving into their dorms this week as we speak, in fact. What's the criteria to find the best college for you, for yourself or for your child?
Well, I think one of the things you have to get over is that there is a perfect school, and also get over the rankings, because I think a lot of students feel, oh, if I don't get into one of the top schools, according to U.S. News, that it's not going to be a good fit, and that's silly. There's like over 2,300 four-year colleges out there, and frankly, a lot of it, I would say, if it's a good fit, one, if it's a good financial fit, because you want to be able to pay for it. I've heard from many parents who spend way too much money to get into the school. Mm-hmm. That's a disaster. Mm-hmm. And also, can you make connections with professors, which is very important. Can you, if you are really set on a particular major, can you get that major, and can you explore different majors if you're not sure what you want to do?
What are some signs that a college or a university may not be the first fit or the best fit in this first semester or first year?
Well, I think the first semester students have to realize they are going to be a little scared. It is going to be intimidating. It is going to be probably the most challenging semester. So they need to know that they're in the same boat as millions of other students, and they shouldn't just think, oh, it's not working out because I just don't feel comfortable yet.
Yeah, it kind of brings me to my next question. A student or a parent might be feeling homesick, let's say, for the student, or they might have just typical anxieties. I know one student I know who was a freshman this year said, I just can't gain those 15 pounds, these random anxieties. But how do you know that that's just normal versus something that might be more serious, or might indeed be, maybe you need to switch schools?
Well, I think one of the things that students should do who are feeling, well, for anybody, if they're just hit the ground running or not, is get involved in their school, because survey after survey shows students who get involved, who get a job on campus, that students who get a job tend to have higher grades. So do students who are involved in organizations, clubs. I mean, get involved. Try to reach out to professors. I mean, if you do things like that, start even looking at career services of your schools. If you get plugged in, you're going, if you're, for instance, having a job in the cafeteria, you're more likely to make friends there, right? Or if you are, on the intramural soccer team, you're going to meet friends. So that is really important, rather than sitting in your dorm room going, oh, I don't know if this is going to work out. Just go for it. Reach out, even if it's uncomfortable, and you're going to have a better experience.
So what I'm hearing is wait a little while.
Yeah,
don't jump into the first semester and then get involved. But what if you do all those things and ultimately you say, you know what, I don't want a school of 30,000. I want a college of 500 or something. What do you need to do as far as financially and the guidelines of getting out of school without just damaging your transcripts and your history?
Well, that's one thing you have to do is, as you're trying to make it work, you can also be looking at other schools, but you need to be, one of the things you need to be careful of is, will your credits transfer? And so you should be talking to this other school's credit evaluator to say, what's the situation? You also would need to be talking to the financial aid office to see what kind of money you might get. You're not going to get as much as college freshmen get. You can also, a great tool for people who are thinking about transferring is the College Board. You can type in the name of any school on the College Board website and then click on the For Transfer Student hyperlink. And that will tell you how many students, transfer students, apply, who get in, what the requirements are to be a transfer student.
What would you say to parents? How could they help, either financially in making a transition or helping the people, the students stay in class?
Well, I think being there, listening to the child, supporting them. I think there's a lot of media stories about, well, how often should you call, or should call once a week? I mean, I think that's silly. It's what your student, your child needs, and that. My daughter was always, wanting to talk, but that's just how she was. My son, we might go 2 weeks without talking to him. That was cool too. But just let them know you're there for them, and also encourage them to get involved, like to get a work-study job or a campus job, or to go and talk to the professor if you need help, or just to connect, that sort of thing.
All right. Well, we have to end it there. I want to thank you, Lynn O'Shaughnessy, so much, and there's a lot more on our website, kpbs.org.
Well, thank you.
I'm Gwen Eiffel. On the next News Hour, former Virginia Governor Bob McDonnell takes the stand in his public corruption trial. That's Thursday on the PBS News Hour.
San Diego Dance Theater wanted to serve up something for the dog days of summer, so it came up with Sweat, Hot Dances for a Hot Night. KPBS arts reporter Beth Accomando takes a look at what's heating up the White Box Theater this weekend.
If you want something hot, then it's best to ask Michael Miserani, whether it's Hot Guys Dancing or Sweat, Hot Dances for a Hot Night.
Dancers will be sweating on stage, and also sweat as in sassy and saucy and evocative.
Miserani serves as both show curator and one of 8 choreographers creating new works for this weekend's show. His piece is called Relentlessly Yours.
So we see Justin at the window. I'm looking out. Stephanie walks in. She stands at the doorway and watches him, and she won't approach him until he turns to look at her. So that's like a go light for her. And this relationship is someone who wants to be with that person, and this other person isn't quite sure anymore if he wants to be there. I like this space because it's very intimate. It's not like you're way back at the Balboa Theater watching a show and you're like, I can't see the people or what's going on. I can't see the faces. I want the audience close. I want them to see what's going on between the characters.
But dancer Sidney Franklin is partial to the floor.
This floor is a wood floor, and it's a hardwood floor, and it has springs in it. I mean, this is great flooring for dancing, especially for what I'm doing, which is tap.
Miserani brought in Franklin to choreograph the only tap piece in the show.
And the theme of this piece I really like. He comes in as a sort of, oh, I'm a shy boy. Oh, you're watching me. Oh, I don't know if I can do it. And then he just he blows you away.
One of the most challenging parts that I was working on was trying to, literally just covering floor, but trying to make the rhythm continuous. So with my piece, I have to create my own music.
Just watching it, I'm like, I don't know how he makes all that noise with his feet and his hands at the same time.
I offset the taps, so then right here sticks out a little bit more, so that way when I clink the shoes together, it actually makes a sound. It helps the audience really get into my head, because I hear the music, and then everyone else just kind of like gets along, maybe claps along with the beat. People's expectations about this show would be that it's only modern, but it's not. We have tap, we have hip-hop, we have modern. I mean, we try to get as much diversity in this show as possible. And we also try to push the boundaries with the dancer's technique, with our own balance. We try to really push ourselves to the limit, and I think we've done it.
Sweat runs tomorrow through Sunday at Liberty Station's White Box Theater. Beth Accomando, KPBS News.
And we are looking at more seasonable temperatures over the next few days, with clouds along the coast in the upper 70s through the weekend there. Low to mid 80s expected for the inland valleys. As for the mountains, mid 70s to low 80s through Sunday. Desert temperatures will be near the 100-degree mark or so. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night.